Well, I'm going to ask you some questions.
Okay, let's go. Let's do
All
it.
right, but everyone, this is Caitlin Gentilina. I've heard great things about her. If you guys are just joining, it's worth repeating because she's so accomplished. She has her master's in public health, a PhD in epidemiology and biostatistics, and by day she's an epidemiologist, data scientist, and scientific consultant to organizations like the CDC. All right. I know you have also a newsletter that you call Your Local Epidemiologist that you launched during the whirlwind of the pandemic, which I'm sure was helpful to a lot of people. Hi, everybody. Someone says too much school for me. Hey, listen, I'm impressed. I think it's really admirable when someone has so much expertise because there are a lot of people, you guys. Oh, look, someone said an ER doctor said you are a rock star. So that must make you feel good, Caitlin. But I think there's so much misinformation, you guys, floating around the internet about science and medicine. Science has been, I think, the target of a lot of distrust. So I am very relieved and excited that I have someone who I can go to who can help me understand what's happening in science and medicine. And I thought I'd start by talking to you about the recommendation that just came out. I think it was last week, Caitlin, that pregnant women and children should not get the COVID vaccine. Even I'm confused about all the vaccine stuff because I don't think I've had a COVID booster in quite a while, and I don't even know what I should be doing vis-a-vis COVID. So, what did you think of that recommendation? And, tell us if it's backed by science or how you feel about it.
Yeah, it's been a confusing mess. In the past week or two, I guess I'm not surprised that you're concerned, even or confused, and even I am. Let's back up a little. Before like this last month, everyone was eligible for a COVID-19 vaccine over the age of 6 months once a year, just like we do with flu. And the reason we do that is because this virus mutates so quickly that the best way of added protection is to match whatever variant is circulating at that time. Those over 65 were eligible for two vaccines, one in fall, one in spring, because COVID is so erratic and unpredictable. What happened over the past week or two is incredibly unprecedented. Um, there's been this growing conversation, scientific conversation it's a legitimate one of like, do we still need a COVID vaccine every year and who needs that? And a lot of scientific experts were having those conversations, and there's a big meeting that's happening at the end of June at CDC to determine that policy. What has transpired over the past 2 weeks, though, is this unprecedented unilateral decision making from political appointees, completely throwing out the policy process in which vaccine decisions are made. So first, the FDA political appointee said one thing that, let's take pregnant people. Pregnant women are eligible for a vaccine. A few days later, RFK says, no, they're not eligible for a vaccine. 2 days later, CDC says, yes, they are, which is really hard to follow the whiplash of those headlines. But it comes down to today, everyone over 65 is eligible for a vaccine. Those under 65 with a chronic disease are eligible for a vaccine. And everyone else, including pregnant women as well as children, are eligible for a vaccine if they chat with their physician. It's called shared clinical decision making. Um, but I'll be honest, I think one of my biggest concerns throughout all of this, even if the eligibility really hasn't changed that much, is the downright confusion, which will sow distrust, and less people are going to get the vaccine, which means less people or empowered to feel like they can make an evidence-based decision. And that's where the true damage really comes from.
Yeah, and I guess it's best to talk to your doctor because you're right. I mean, I'm confused. Are these recommendations? Are they, recommending against pregnant women getting the vaccine? So I guess it's just something you have to talk with your doctor about. And I'm 68, and honestly, I don't think I've gotten a vaccine for quite a while. Is that terrible?
It's not terrible. I would suggest you do once a year. But I mean,
Once a
I
year.
yeah, once a year. I mean, I view it as the older you are, the higher risk you are, especially if you have more comorbidity. So my grandpa is 95 years old. I tell him for sure, go get it, right? Your immune system is weaker, et cetera. Those around the 65-year-old mark that are very healthy, you're not going to end up in an ICU, but it does protect against some level of infection, which means missing less work, means getting to see grandkids more, etc.
Yeah, I wanted to ask you about this summer wave brewing amid all this confusion. Are
Yeah.
we expecting a wave of COVID this summer?
We are. So, if we look historically, we have seen a pretty substantial wave every summer the past 5 years for COVID-19. I will say this is really weird for viruses to do. Typically, we see it in the winter with flu and RSV and common colds, even. But I mean, not every virus is the same. So, yeah, we are expecting a wave. How big it's going to be is really, we don't know. When the timing is going to be, we're not entirely sure. But we can look at past patterns to be pretty darn confident that something's going to happen this summer.
Okay, so it's not too late, for example, for me to get the vaccine.
It is not too late for you to get the vaccine, no.
And in terms of if we have a wave this summer, someone I forgot his name, but asked about bird flu, and we did get a lot of questions, Caitlin, on social media for me to ask you about bird flu. I'm embarrassed that I mean, I've sort of been following bird flu. I feel like I'm drinking out of a fire hose every day with all the news that is happening all over the world and especially in this country. So I'm embarrassed to say know the latest on bird flu.
No, it's okay, and that's why we have experts to help
Yeah, exactly.
keep track of it. Yeah, bird flu is something that has really picked up steam and heat over the past year or two in the United States. Before then, it's been pretty quiet. It's mainly in animals, so those people that are most at risk for bird flu infection are farm workers, and people that are close to poultry in their backyard. Interestingly, what we've seen in the past few months is a decline in circulation of bird flu. So it's not as rampant as it was, for example, last year. And we don't really know why. Viruses can do really weird things. Birds are migrating. Maybe it's burning out in cows. We're not entirely sure. But right now, the risk to the average person is very low. And I'll even say the risk of a pandemic is a bit low too. I would say about 5%. So this is something us epidemiologists have red flags about we're paying attention to. But I'll say, like, given the am I allowed to cuss on here? Like the shitstorm that's happening right now, like
Yes,
that
feel
shouldn't
free to cuss. This is my cussing place. This is
that
where I
shouldn't
like
be
bleh.
it really shouldn't be like the top mind for the general public right now. There's other things to be worried about out there.
And if we need to worry about it more, I'm sure you'll let us
I'll
know
tell
and
you.
we'll
Yes.
definitely spread the word. I wanted to ask you about the measles and what is going on there. As of Friday, there were 1,132 confirmed measles cases in the US, more than 1,800 in Mexico, 27, almost 2,800 in Canada. West Texas remains the hot spot. So it says growth there has slowed. How concerned are you about this measles outbreak?
I mean, measles is coming in hot this year. We are on track to break the record of number of measles cases in the United States in the past 25 years since we eliminated it. And so I'm not very excited that measles is spreading and that children are dying because of it. Now, again, those that are fully protected, fully vaccinated, this is shouldn't be top of mind. You're very well protected. So I'm really concerned about the highest risk. Me being a mom, I'm worried about our kiddos under 1 years old that have zero protection. I'm worried about the unvaccinated among those that have a lot of questions and hesitancy and mistrust. But I also think that this measles outbreak, if we take more of a a higher level view, is a signal of something much bigger. Because measles is so transmissible, it's usually the first building block to fall in vaccine preventable diseases. And we really need to figure out how not to continue going backwards, but going forwards. And given the current landscape and policy making that's happening right now, I'm very concerned we're going to keep going backwards until we go forwards.
And we should remind people measles can be very, very dangerous, right? I mean, I think people think, "Oh gosh, it's fine. You get measles and then you're fine." But it can lead to a lot of other secondary illnesses that are quite dangerous, especially for children, right?
That's absolutely right. Measles, for a majority of people, they'll be just fine, but it's a big gamble. It's a game of roulette we're basically playing with, right? Out of 10,000 children that get measles, 2,000 are going to be hospitalized. About 1,000 will lose their hearing. 10 to 30 kids will die out of 10,000 cases. It's just not something you want to play around with. The other really interesting thing about measles that not a lot of people know is that when you get infected by measles and you survive, obviously. What measles does is it's called immune amnesia. It wipes out your immune memory for other viruses like flu or COVID, for example. And so what we see is once you survive measles, you can die 5, 10 years later from flu because you have no immune response. Measles virus is just not something we want to play around with. And it's it's the most contagious virus we know on Earth.
I wanted to ask you about this Maha report as well. I wonder how you feel about the fact that there was a formatting error, according to Caroline Levitt, the White House press secretary, when people brought to her attention, and it's been written about, that many of the studies that were cited never happened. Many of the studies were misrepresented. The authors of these supposed studies say they were misunderstood or not even done. I mean, it's a hot mess, basically, Caitlin. So I know, yes, they did get some things right about the health of Americans, right? And the obesity epidemic, et cetera. But there was a lot there that was incredibly sketchy, right?
You're right. I mean, that was my general impression when I read it. I was like, "Oh, there's actually some good ideas here." I do think the intent is there too. It's quite refreshing to hear chronic diseases get so much attention, given how much they do wreak havoc on Americans. But my second reaction was like, "Holy crap, this is super incomplete." Like, there's not telling the whole scientific story around autism or vaccines, for example, which makes me then question ideology behind it. And then you're right, it was revealed that it was built on quote unquote studies that one aren't even studies, right? Possibly even written just by Chat GPT. And some of the studies that were there were misrepresented. And this brings a bigger piece of concern of mine is that it's unclear with that report whether scientists, public health professionals, physicians, with strong scientific research and writing skills were even involved in the first place. There was very little transparency on who wrote that, where this came from. And I think that we should hold their feet to a fire and expect a higher standard, given that all of our health is on the line here. And we do need to move in the right direction instead of spinning our wheels.
Another unanswered question I know for you is, okay, uh, Americans are very unhealthy. We need to do something about the root causes of disease, which I agree with 100%. But funding for many of these initiatives have been slashed, $1.8 billion in medical research funding from the NIH. And of course, the NIH gives most of its money to research universities. Many of these research universities have programs that have been stopped. Clinical trials have been stopped midstream. And a lot of the people who are responsible for really monitoring food safety, for example, all the things that you would think should be in place uh, have now been dismantled or so significantly reduced that it's honestly like cutting off your nose to spite your face. I don't know why they are pointing to this problem, but everything we have in place that could address it has been, you know, dismantled.
That's exactly the next question I came from with that report is that, like, okay, this all sounds good. Like, how the heck are we going to, what is the feasibility? Like, how are we going to actually accomplish this when the exact resources we have are being dismantled? And you're right, it is NIH. That means scientific advances in cancer and diabetes are being sidelined. But it also means like actual programs on the ground are feeling this, right? We're having cuts of USDA programs that support healthy school meals and local farmers, and that's being slashed, right? We don't have a CDC team anymore helping respond to the lead crisis in Milwaukee's schools because of cuts
The
to
what crisis? Sorry.
lead
Oh,
crisis in schools, right? That are because of these widespread layoffs. We have less transparency and accountability. I don't know. I mean, I could keep going on, and it's just, and then that's all that's already happened, right, Katie? Like, there's more cuts coming down the line. 53% more cuts with NIH, more cuts to the CDC workforce. SNAP is getting cut. Like, we're really going to start taking like food away from kids, and that's not going to make them any more healthy. And so there's this really interesting distinction between and misalignment where I'm trying to reconcile in my head like what MAGA is doing and the inability for actually MAGA to say what they want to say. And it's a really, I don't know how they're going to accomplish this stuff. I know in August they're coming out with their actual strategy, right? This Maha report was basically just a descriptive lay of the landscape that they see in their value system, but they're supposed to come up with like strategies. And I'll be very curious how they come up with strategies after they're cutting SNAP and Medicaid, for example.
I wanted to ask you, James Lyons Weiler has written in and said NIH is giving US $5 million to study root causes of autism. Finally, thank goodness, something that he is happy about. Um, but I imagine an epidemiologist and scientist slash statistician like you would take that research with a bit of a grain of salt, or is it a positive net for the autism community?
I mean, I think the autism community deserves more answers. I think that there's a lot to still discover. I think that they also need a lot of support. Um, I think where my skepticism comes in play, and maybe we have to see how this plays out, is if there's predefined outcomes that they want to see, right? Autism and vaccines is comes to mind. Whether they're engaging the autism community to ask patients and families what they want and what is helpful to them, as well as, yeah, being transparent on what this process is, who's funding these things, or who this money is going towards. Is it going to help us move in the right direction and push the envelope in innovation? Those are all unanswered questions that I guess we'll just see with time. So I guess I always love seeing money go to research if it's done the right way and in the right hands with the right motivations.
I think part of the problem with autism research, and I'm not an expert by any means, but I've read a lot, and there was a very good documentary on PBS called A Shot in the Arm, and I interviewed the director, and Neil deGrasse Tyson was an executive producer. But there's a vacuum when people don't really have the answers, and maybe it's better reporting, maybe it's older fathers. I know there are a lot of theories out there, but when there is that vacuum, then sometimes that makes it very right for people to draw conclusions about vaccines. And I think that at least kind of helping people understand other potential causes would be ultimately a good thing. But as you said, if there's a predisposition to point a finger at vaccines when that's the research and the science does not bear that out, given the fact that RFK Jr. has been very skeptical about vaccines in the past, then that's something I think we should be concerned about.
Yeah, totally. I also think that there's a certain level of cruelty with false hope, and them saying we're going to have answers of what causes autism by September is just unattainable in a scientific, transparent way. So either they're not going to have answers by September, or the answers are going to be, like you said, predisposed. They already know what they're trying to get to, and both of those uh, concern me a lot.
What is your relationship? I'm curious, since you have been an advisor to the CDC. Have you had any dealings with the CDC in its current incarnation, and what has it been like, or have you not have your services no longer been needed?
So I was a senior advisor to the director for the past two directors, so Walensky and Cohen. I stayed on, and then it was dodged by Elon Musk in February. And so I saw maybe, first few weeks of what that looked like, but I'm now no longer invited into the agency. I do have a ton of close friends, though,
And what are they
and
telling you about how the CDC is operating these days? Are you allowed to say that, or do you have to keep their confidence?
yeah, I mean, I won't say names or anything, but I don't think it's too surprising. I mean, there's a lot of moral injury happening right now, being asked to do things that they don't necessarily agree with. We saw that with vitamin A and measles a few months ago. There's a lot of uncertainty, and with so much uncertainty, they feel paralyzed and not wanting to innovate or move in a forward direction, which I don't think is helpful for the American people. And there's a lot of stress. They've seen, 15% of their workforce fired overnight. And that is usually not a great workplace environment to be a part of. And knowing that 50% more cuts are coming your way is really hard to work in that environment. So I think a lot of people right now are seeing how things play out, trying to figure out where their red line is to jump ship or stay forward. I think people forget that federal workers are there for the service. They're there for the mission. They don't get paid well, like at all. And they're there because they believe in improving people's lives. And I think once that mission becomes a little more gray and uncertain, we're going to lose a lot more workforce, which is my biggest concern.
Yeah, somebody was saying that there should be a shadow CDC until this all gets taken care of. I'm curious. Uh,
It's called Your Local Epidemiologist.
oh,
um,
there you go.
I'm just kidding. Yeah, I'll tell you, there's a lot of big gaps that are being filled outside of federal government right now. There's the Vaccine Integrity Project that's happening over at Minnesota. There's a few groups that are preserving healthcare data or health data in case, CDC or states start turning it off. There's communication efforts like I'm doing with a few others. So there's definitely patching happening, but that none of that replaces what the power of the US federal government can have. And this dismantling.
Whoops.
Whoa, it's okay.
Oh, sorry. I was trying. Oh gosh, I'm sorry, everyone. I was trying to read some of these comments. Honestly, Caitlin, I need to up my equipment game over here in my apartment. Sorry,
No.
Joan Didion. Joan Didion is so embarrassed for me. But anyway, sorry, what were you saying?
No, I was just saying there's a lot of efforts that are happening outside of the federal government. There's just nothing that can replace the federal government, and I think that it's going to take at least a decade to rebuild after a lot of this destruction and rubble to really be useful for the American public that they deserve.
It's really upsetting. I interviewed Francis Collins, who has got to be, I mean, you probably know him, Caitlin. He's the nicest person on the planet. He's such a gem. And, he explained how $1.8 billion taken away from NIH is just going to be a total disaster. And not to mention, obviously, we were talking about like clinical trials being stopped, but but also the brain drain. I was
Yeah.
talking to someone at Johns Hopkins who I know, and all these scientists are getting wooed by China and saying, "What do you want to study? Come over to our country and you can study whatever you want." And we're going to lose our competitive edge when it comes to scientific breakthroughs. And I think it's such a travesty. And it's like USAID. You can't dismantle things and then expect them to get built up overnight. These things take years, and many smart people to put it back together again. And it's really upsetting. But I know that people so appreciate your expertise. I have so much respect for scientists and anyone who's in the medical field. I do a lot of cancer advocacy work, Caitlin, and I care deeply, especially about all medical research, but cancer research. My husband died of colon cancer. My sister died of pancreatic cancer. I know I have had a lot of friends, and I'm particularly concerned about younger people being diagnosed with cancer, colon cancer, and other digestive cancers, and they're trying to figure out why. So I can't tell you how much I appreciate people like you and what you do for a living. And we're making fun of well, I wasn't, but somebody was making fun of of your schooling and all your expertise. But I don't know, when did it become a bad thing to be an expert? I mean, it's just so bizarre to me. I have so much respect for people who have expertise. I just don't get it.
I don't get it either. What I've heard is there's been a lot of loss of trust. We can build that. We can meet people where they're at, where they are. We can do better. But you're right. I mean, we as a country, we can't lose that value of expertise. I don't want to go to my mechanic and understand how the engine works, right? I go to them so I can focus on what's important to my family, and I hope that I can continue to be a service to Americans in that way too. So, yeah, thanks for having me, Katie. This is
Well,
great.
it's such a pleasure to meet you. And if people don't know, you have an excellent newsletter, which I'm going to sign up for after our conversation, Caitlin, called Your Local Epidemiologist. You have a ton of fans who are watching this. And of course, people can see you and hear your take on Substack, just like me. I'm a Substack newbie. And so far, I'm really enjoying it, and I'm getting the hang of it because
Good.
I'm not quite sure what I'm doing, but I'm trying.
None
I'm
of us
learning,
do.
Caitlin. I'm learning.
Welcome to the world. I have no idea what I'm doing, but we can learn together. I'm happy that you're here. It's a good platform to be on. So thank you so much, Katie, for having me.
Well, great to meet you. And thanks, everyone. And have a great
All right.
evening. It's beautiful in New York. So I'm going to go take a walk.
Amazing. All right.
Okay. All right.
Bye now.
Bye.